Good afternoon to each and everyone here. First of all, I congratulate you for asking a question which is really very, most of the people will be hesitant to ask the question. And this is the problem with women. Whatever the problems they have, they are not open and they don't ask with open mind. And in spite of their sufferings, they won't come up boldly to know the answer. So I really appreciate you. And sexual problem, particularly it can be either the normal married life or the sexual harassment which occurs in the working place, and it may be in the education institution, the adolescent girls facing it. So it can be very problem which we face. But my advice is, from the childhood, when they enter the adolescent age, awareness should be there. They should be aware of the situation. Actually, we all feel that we are all very modern and now we are teaching the children properly, but not. Always you have to connect with our roots. Some of the programs, festivals, functions are carried out in our society. And nowadays the Menarche festival and the Valagapu, the Simandam festival, we are all looking at with a biased view. But when a research was done, when I was PG in Ramchandra Medical College, the holistic approach and the research was done, they were very safe. Nowadays they are facing the sexual harassment, and nowadays they are unable to cope up with the life. But our elders, our ancestors, mothers, grandmothers had a very smooth sailing. We think that they are cowardish and they were very much successful. So the society taught us naturally the awareness. For example, in a village, if a Menarche function is conducted, then the other children know. So such developments will be there in our body, and there will be a phase we have to cross. And when we were, some of the students, when we were doing gynecology, were criticizing this Valagapu. So what is this? We are calling everybody, and then one of the elder when we had a small interaction, whether it is useful to the society or it is only a luxurious function arranged by the family. Then some of the elders told, because when such programs are conducted, festivals are conducted, it conveys a message to the other youngsters, because we have to undergo such physical changes in our body. So it is not only unique to us. So it is natural thing which is happening in all the other women also. So that awareness should be there. And nowadays we are hesitant to talk with our children also. When they start talking about something, so we stop them. No, this is not the subject to be openly discussed, or this is not the subject. So when they grow into an adolescent girl, and when they enter into the married life, or when they go to the professional, their offices or their career, when they face with such situations, they are unable to reveal it outside, and that makes them depressed, and they makes them unhappy. So first of all, we have to have a good interaction with the children, and now we have to make them aware of the problems. And if at all you are facing, as you said, then you have to have a good consultation with a gynecologist or elders, or you can have a good counseling. So nothing wrong in revealing certain things, so that getting the solution. Thank you very much, ma'am. Anyone else that would like to ask a question?
Sure. I would like to ask a question.
Yes, please go.
Thank you so much for the opportunity, ma'am.
Who is asking?
I am asking. Ma'am, here I am.
Yeah.
Ma'am, I'm Gautami. This is a great opportunity for me to ask you a question. So, I am representing a working woman. It's not easy for a woman to handle so many chows at home and manage to come to work and give her 100%. You're a fellow working woman too. How did you manage? How did you manage your mental health, physical health to give your 100% and to be in a state where you are?
First of all, start enjoying your work. Whether you have one state or two states, start enjoying. Don't think it is a burden or that is a responsibility. I start enjoying. In a lighter sense, I can say when I was coming in the flight, I have two cell phones in my hand. So an elderly person was sitting beside me. So when I was taking my one phone got dropped. Then he was telling me, we are unable to handle one phone. Why are you, how can you handle two phones? Why are you having two phones? I told him, I am handling two states. What is the problem in handling the two phones? So it's all with the mindset only. And I always enjoy doing, because if another responsibility is given, there's an opportunity to show our talents and show our administration. So it is always take it as an opportunity. But plan your life. I always ask, when I was practicing, the ladies used to come and tell, Doctor, tension, for everything tension. What tension? Wear which saree, which blouse to wear, that's a tension. Then which Colombo to keep tension, which side dish to tension, whether to do what is idli or dosa, that is the tension. So why can't you in the evening when you are seeing the serials? So tomorrow morning, what will be my tiffin and what will be my dress? Everything is a little planning and little time management will definitely help you. And always don't get tensed. When I was attending a CEO's conference, there was a 2 days discussion. And they were telling, I was asking, what we were discussing. So they were telling, no, we are CEOs. We are unable to get the service of our employees because we are expecting more. And the employees are what they, according to our expectation, we are not getting our employees. So we are tensed. We are unable to get the service. So I told in my valedictory program, I told it's very simple. For example, when we expect everything from everybody, you satisfy yourself by certain things. So I was telling in that meeting, you are 2 days you have conducted a conference. I will tell you one simple thing, because in my house, I have a driver who is working for 15 years and I have a cook who is working for 20 years. Then one of my friends came and asked me, you are having your driver for 15 years and I am in my house, every month I am changing my driver. Cook you are having for 20 years, I am changing my cook at least in 15 days, I am not satisfied. Then I told them, she was asking me, so she is good in cooking everything. Then I told, no, I love dosa, but she is good in cooking idli. So I started liking idlis. Than searching a person who is making good dosa. So it is easy, no? So searching another person who can do good dosas, practicing eating idli which she is doing. So it solves the problem. So it's all in our mindset only. So let us enjoy and adjust to the situation. But our motto is just we have to exemplify in our small things. So focus should be on our work and don't compromise your happiness for anything. Let whatever the work, I always say that God, whatever may be the load you give me, but strengthen my shoulders to hold the load. So that is the conviction we should have. So always enjoy what you are doing. Whether your officer gives you another file, when you are about to start 5 o'clock, you are called and given 2 or 3 files, then smile. I have an opportunity to see more files. So that is the mindset you have to have.
Thank you so much, ma'am.
Excuse me, I've got a question here. Very warm good afternoon to all the dignitaries on the... It's me, ma'am. Very warm good afternoon to all the dignitaries present on the dais, Honorable Governor of our state, and all the, I think, VIPs who are here for this event. Ma'am, basically my question is to you and Team Kim's as well. I was just listening to all the facilities and the advancements of technologies which are available with the hospital over here. It's a very good thing. And now the question comes about affordability. My question is, all these facilities can be availed by people who are able to afford. So, ma'am, as you are heading as a state, why can't we introduce all these facilities in a subsidized rate or, free for the below poverty line people? The mortality rate is high even in those communities. There are children perishing, neonatal kids are perishing without proper treatment. So my question is, why can't the government come forward and also have such kind of centers where they can go and avail these facilities?
And definitely there are centers, but this is the question. Through your question, I want to convey the message about health insurance. The awareness about health insurance is much lower in our society. Because it is very difficult. Governments are coming out with schemes. For example, Arogyashri, Ayushman Bharat, and even 5 lakh rupee treatment, we can get it done freely. And I laud our Honorable Prime Minister because women oriented, before cesarean was not included in the insurance scheme. Most of the insurance companies say only diseases we include. But Ayushman Bharat, first when it was introduced, it was cesarean section was not included, and because of the appeal from the womenhood, it was included. So now, first of all, we should be aware of what all the facilities available in the government hospitals, totally free, and what all the facilities available in the government hospitals in subsidized rate, and what all the facilities available in corporate hospitals, particularly KIMS. I really appreciate this. Your Bhaskar Reddy Garu is here. When I knew about their work on breast cancer awareness and taking the awareness to each and every village. So mammogram to be done in a corporate hospital, they have to come here, register, but they are taking the mammogram towards the people. So, but we should be aware of the services. For example, medicine, where we can get. Nowadays, there are this Janaushadhi shops are there. Not all medicines we can get, but some simple generic medicines we can get it. And these all the facilities already available for the poor. But I always appeal to the governments. Even Telangana government recently, when I attended a medical camp, I appeal. All the facilities should reach the people. So that awareness should be created, particularly the womenhood, because this conference is about women health. Actually, there was a survey, some 30 years back, there was a survey that before under 5, male children were more sick and the percentage of sick male children were more, and there were no very minimal percentage of female children. Then everyone was very happy. Oh, female children are more resistant and they are not sick. Only male children are not with resistant and they are more prone to sickness. But that survey revealed that even the girl child is sick. She is not brought to the OP. So surveys also can sometimes deceive us. So they thought the girl children, there is no any percentage of more percentage of girl children attending the OP. So the girl children are more healthy. It's not that. The sick girl children were not brought to the hospital at all. Their health was ignored. So we have to find out the places where the facilities are given free of cost, nominal cost, even in the corporate hospitals. Nowadays, even they are treating the poor. So we have to be aware of the situation. Most of the governments and the corporate hospitals and all the insurances are coming out with good schemes.
Yeah, ma'am. Actually, I am heading a health insurance processing company only. So that's the reason I thought I will just ask this.
Yeah.
And ma'am, any idea when is the Ayushman Bharat being implemented in Telangana?
Yeah, because when I came here as governor, I knew that I found that Ayushman Bharat was not implemented here. Then when I had a discussion, at that time I used to discuss with the Chief Minister. So when I had a discussion with him, I was telling in Tamil Nadu also, Ayushman Bharat, when it was introduced, there was a CM scheme. But both CM scheme and PM scheme combined, more than 80,000 people added more to that scheme, and people were benefited. So even though don't actually argue whether this state scheme is better, central scheme is better. Central has come out with this insurance scheme. State is having its insurance scheme. So and when both incorporated combined, the people may be benefited. Then after that Telangana, then I also gave him the report from Tamil Nadu, how the central and state schemes combined to help the people, and after that they signed an MOU to follow the Ayushman. That after my small effort, it was done. So when state and center cooperatively do, the great things can be done to the people. That is my
only
view.
the signatures have been done, ma'am. Implementation, I think efforts are required for that as well. Push from your end.
Oh, because I am not following and they are not interacting with the health officials for the past 2 years. I am unable to reach out there. So it's a news for me. So I will put all my efforts to follow that, because I also told about some of the added points in Ayushman, because Arogyashri is our state insurance. Ayushman, if a person from Telangana get the treatment done in different state also, Ayushman can be actually utilized. So these are things, good thing you told me, so I will put my efforts.
Thank you so much, ma'am.
Because in the previous program also I told this, but I don't know because it's only in the in this form. I don't know. I will put my efforts.
Thank you so much, ma'am. It was really
because in Puducherry, where I am the additional charge, Ayushman Bharat is utilized to its maximum, and we had we were awarded a prize for that. Second place we had for implementing Ayushman Bharat. Because as a doctor, because I am direct in administration, I could do that. Thank you very much, ma'am.
Thank you so much, ma'am, for sharing your insights on this.
Thank you.
And you've given us really very useful insights on how to go about in our workplaces.
Yes.
Also. Thank you.
Thank you.
Thank you, ma'am. We will take one last question, and then I would request our Honorable Chief Guest to address the gathering.
Thank you, ma'am, for your...
Oh, okay. She and then... okay. Both can ask, no problem, because...
Sorry, I didn't...
Both can ask. After that, you can ask.
My name is Hima. I'm from OpenText. I'm working as Senior Manager, leading security. Ma'am, what's the secret of your energetic leadership? There are like so many apps and fitness programs, yoga, gym, and cycling clubs. There is like marathons. Like, what do you think that as women we should focus on the health regarding this, related to this fitness? Because an energetic leader will always improve the productivity of the corporate and also can balance work and personal life as well.
Okay. Changing the obstacles into opportunities. That is the secret of my energy. When the river flows, suddenly if there is a block, electricity will be produced, no? So I will be moving very fast. If there is any challenge, then I will be more energetic. So that is way. And it's a very good question, because basically I used to say, we can say that Sri Rabindranath Tagore says, you'll be longing to see Niagara Falls there, here, I want to go there, but you fail to see the drop of dew just on the top of the grass in front of our door. If we open it, it is the nature gifted with a dewdrop on the grass. We don't enjoy that. No, we'll be longing for greater things. So don't think that you have to go gym. And I have not gone to gym at all. But I do yoga for 1 hour. Definitely 1 hour I do yoga. And I walk morning half an hour, evening half an hour I walk. Because I walk only, whether the floor, whether the challenges, whether it's ups or down, I will walk. Definitely. So only I am in Telangana, I am facing all the challenges, but I can walk. I can move through. I can move through. Anything I can do. Because early morning you get up and thank God for giving the opportunity to rise in the morning without any sickness, and drink lot of water in the morning, and then start your yoga. Don't be lazy. Yoga, meditation, and actually allot some time for you. Don't think that files, work. Definitely I allot. When I go to the colleges, when I ask them, how many of you do yoga? Very less number of children raise their hands. Then when I asked them, they used to tell, no, I don't have time. Then I used to tell you, Governor, handling 2 states have time to do yoga for 1 hour. Then are you busy than me? I used to say, no, we are not busy. So why can't you allot time? So if you allot time, no, if you can, the productivity will be more. Don't think that 1 hour is waste. I can do 48 hours work in 24 hours. I can challenge. I am doing like that. Everyone will think, now you are in Telangana, now you are in Puducherry, now you are attending a program. Yesterday morning I was in Goa. Evening I was in Visakhapatnam. And now I am in Telangana. Evening I will be in Puducherry. So this is how we have to tone our body and mind. That is practice our mind. So physical fitness is very, very important. So only our Honorable Prime Minister always says fit India. So we have to be very cautious about our food. I always say, we are counting our currencies. Are we counting our calories? Yeah, hardly. We have to. If I take on ice cream, no, I will just stop with I like ice cream very much. But I don't deny tasting it, but I will take it and within quarter ice cream I will stop. Okay, this is more than enough for my body. So I am not deceiving my taste buds. I am not deceiving my body. I am enjoying at the same time, but limiting. I am limiting myself. So food also, always have a small plate. Now small plate concept is there. 3/4 of the plate should be with vegetables and fruits. Only quarter plate. It's easy, no, for you. You can tell so that you don't need to cook, no. Otherwise put sambar, rasam and put to cutting and you easily tell your husband, no, this is the now new concept. All cut vegetables 1/4, cut fruits 1/4 and some cereals 1/4, only little rice. For that you need not have too delicious Colombo, this and that, because rasam and all, you just take some curd and eat it away. So your work is also minimized. So always follow these things. So it will be easy for you also. So nutrition, food habits, altered food habits. Our Honorable Prime Minister life is a small changes. So that will improve our environment. Like little changes. If you are eating 4 idlis at a time, 2 idlis by 7 o'clock, then spread it to 10 o'clock 2 idlis, then definitely that will help you. So plan your diet and plan your habits, but mentally always free. And I always finally to everyone I used to say, don't compromise your happiness for anything. Life is for enjoying. If you want to get a sari, go and get it. You want to get a jewel, go and get it. No problem at all. But you should be very healthy to see your husband. So now I have got it, but I will cooperate with you more, whether in business or in family. So that will get great results. So small lifestyle changes is more than enough. It's not that you have to spend more. You have to spend more for the nutrition. Sometimes they will say, no, for protein diet. So that is 700 I am going to get. And this 600, no, nothing. A white egg in the morning will give you more protein than any other nutritious artificial food. So be natural. Always think of our mother, grandmother, what they took, you take that. That is a simple solution for you. My grandmother lived 80 years, my grandfather lived 90 years. They took every day little vegetables, fish they took every day, some buttermilk. So very simple food they had. So always plan your life and diet. Planning is more important.
Thank you, ma'am.
Okay, thank you very much. I have very less time. I always love to answer because I will be talking to you. I don't know what you want, I'll be talking. But now I answered what you wanted and then I answered. It's really a great interaction session. And I always want, in every program, you have to utilize the opportunities given to you. When you utilize the opportunities only, we can get some. I'm not saying I'm a great person, but we are successful. They used to ask me whether you are an extraordinary person in this age you became a governor. I'm a very, very ordinary person. I also like saris, also like flowers, jimkis, bangles, everything I like. I'm a very, very ordinary woman, but I do things in an extraordinary way. A simple thing also, it should be done. My work should be on top. My work, even Raj Bhavan, I'm not confined to Raj Bhavan because today also a paper has reported how I have taken forward the work of tribal activities. So we have to focus on our commitment, whatever may be the problems we face, definitely there will be challenges. I can say, Bhaskar Reddy Garu, please pardon me, and if a man should come from the other brothers also should excuse me, and other media friends also, male members should excuse me. If a man want to come out from the house, just he can take an iron shirt, put it, and he can come away. But for a woman to come out from the house, she has to look after whether you have to cook the food and whether it should be kept in the dining table. And when mother-in-law, you have to be very careful. When mother-in-law will come and whether she will eat, and when the children will come, and when the milkman will come and deliver the milk, and when the postman will come and deliver the post, with all these calculations, you have to come out. So one woman coming out successfully is equal to 1,000 men coming out successfully. So it is not easy. By my personal experience, I will be my children are grown, all are doctors now, but when my child was there, I will be doing a cesarean. Then my child will, where is my pencil? Ask my mother immediately to answer her. Then my assistant will come and tell, your child is calling repeatedly, what is the problem? No, I am having a knife. No, she's asking about her pencil. So this is the challenge. She won't ask her father. She will ask her mother only. Then sometimes we will have, birthday program is there. We will come by 7 o'clock. At that time we will have a cesarean. At that time we will have, we will be changing our dress. We will be stepping out. Suddenly one patient with pain will come. The other relievers wouldn't have come. So immediately we will be forced to go to the theatre. And another 2 to 3 hours, the child will be crying there. Then these are all the challenges we face. So we have to face the challenges. There are difficulties, but women are multifaceted. They can do anything. They can do anything, whatever the work you give. And this is a land where Rudrama Devi, leaders were there. So I am very confident that women are really good administrators. Why means it is for men it is very difficult to manage a woman, but for a woman it is very easy to manage everyone, even a man. So as an administrator, I am telling with my experience. So we can be very cool, and that is it's all in our hands. So only some of them are not allowing us, because if you allow a woman, definitely they will catch the place. So they will exemplify. So only even now our legs are pulled. But in spite of that, we will run fast to reach the goal. And apart from that, my request is the family and awareness. Nowadays we know about breast cancer, and there are some diseases. Heart problem. When I was asking my relative about heart problem, women will have heart attack. Then she was saying, no, women won't get heart attack at all. Only men will have heart attack. Then one of the person told, no, if I have a wife like you, definitely men will only have a heart attack. In a lighter sense, he was telling. But women also get heart attack. Women also should be aware of another thing. More women are now affected with brain clots. So these are all things which we are not aware. Osteoporosis, we are not aware. And all the other, we are aware about, nowadays we are aware of ovarian problem, uterus problem, but other medical conditions also will affect the women. So when we have some symptoms, when we experience some symptoms, immediately we must go to the hospital. Yearly checkup is very much needed. You don't plan that for this birthday I have to get this sari, I have to get this jewel. For the birthday, because we are passing another year, definitely you have to have a medical checkup. So that should be the gift. I appeal all the husbands, please gift a voucher for the master health checkup than giving a voucher for the sari, or it should be done, whether it's a previous day or after, but whenever before celebrating your next birthday, you have to have a full master health checkup. That is very, very important, because the diseases which are diagnosed much earlier. Now, there are treatments for everything. Anything, because before and all cancer means, everyone will be afraid. In cinema and all cancer diagnosed means dying, like that, they will show. No, very calmly. I have seen, even our Bhaskar Reddy Garu also attended a program to give awareness about health, breast cancer. The survivors, they didn't have any shadow of breast cancer. They came, and they revealed their helplessness. So there are opportunities. Give the doctors also give the opportunity to save you. Don't come in a very chronic stage. Don't ignore your health. You know, if it's a plant, if the weed is very small, it can be easily plucked. But if you grow into a tree, it cannot be plucked. It cannot be cut also. So always aware of this. But another thing, nowadays the incidences are more, whether it is uterine cancer, breast cancer, or hypertension, or sugar. It is very difficult to cross 40 without either hypertensive or sugar. So it is, you have to be much aware of it, and you have to spend some time for that also. It may be a repetition. I always narrate one incident. When I was a postgraduate at Ramchandra Medical College, when we were postgraduates in the Department of Gynecology, usually there will be an annual event. When I entered, there was also a jewelry exhibition in this campus, like that. An exhibition, the annual exhibition will be there about saris and what all the cosmetics which are used by the women. So once a year it will be conducted, and lakhs of women will attend this program. So when we were PGs, we asked our HOD, Madam, large number of women will be attending this program. So we will hire a stall. With all our efforts, our PGs will collect money, and we will hire a stall, and we will have an awareness program. So that whole night we sat and drew pictures about breast cancer, pap smear, how it can be diagnosed at the earliest, everything. And then we displayed all the charts, and we had a mobile mammogram there, and then pap smear kit there, and then with coat, with stethoscope, we postgraduates were sitting. So ladies started coming. So first this was sari shop. So ladies came, they put the sari this shoulder, that shoulder, and they saw in the mirror. Then we were ready, because next they have come to the sari shop. So next they will enter our stall. So that we put a coat, and then we were ready with the stethoscope and everything. These ladies, they entered the sari shop. Quickly they passed our stall, and they entered the jewelry shop. Then we were watching, nobody entered. Then we pulled them. No, if you are doing that, if you are hale and healthy only, you can wear this sari and you can wear the jewel. Then you won't believe, after we compelled everyone, they attended, they came to the stall, and they had the checkups, and 300 patients were diagnosed with precancerous condition. Either it was breast or uterine. In that, some 2 lakhs, 3 lakhs people attended, 300 people were diagnosed with precancerous situation. Only just screening helped them. Otherwise, they would have come up with uterine cancer or breast cancer in a later stage. So, always concentrate on your health. That is wealth. First preference is health, health, health. Everything is next only. Your profession next. Whether your luxury or your academics, everything is next only. First health. சுவர் இருந்தால்தான் சித்திரம் வரைய முடியும்னு தமிழ்ல ஒரு பழமொழி இருக்கு. If you have a wall only you can paint. If you don't have a wall you cannot paint. One person was telling, no, I want to go to, every day I want to go to the office exactly by 9 o'clock. Then his friend asked, no, every day you want to go to exactly punctually 9 o'clock, why can't you go? No, I don't have a job. If I have a job, I will have a job. So, intention may be good, but if you have a healthy body only, mind only, so always be free. Life is for happy living, and health is more. You may be a very big academician, you may be a very big artist, but small headache just collapse you. With small, it may be not bilateral, migraine will collapse you. So always be healthy. That is the message, and I really appreciate the organizers, particularly Shilpa Reddy Garu, for organizing such a program. Because whatever maybe, I always tell a small story, and I will complete it because I have to catch the flight. There was a farmer. He was a very poor farmer, and he wanted to sell his land. Because he thought unless he sell the land, he won't counter his poorness, poverty. And then he asked an advertisement person to write an advertisement, because everything nowadays are for advertisement only. He asked the person to write an advertisement. Then that person wrote an advertisement. This is a piece of land is there, And there are 2 to 3 guava trees where we can get good, very delicious guava, and there are some coconut trees in there, something and all positive. Then he told there is a school nearby means 60-70 kilometers. The advertisement will be like that only now. So he told nearby school, nearby police station, this station, that and all. He wrote and he gave the advertisement. Then that person told, no, I am not going to sell the land. Then the advertiser got angry, that media person got angry. Just few minutes back you told you are going to sell the land. And after writing this advertisement, you are telling you are not going to sell the land. Then the advertiser told, that farmer told, till you write this advertisement, I didn't know so many good things are in my farm. But when you wrote the advertisement, then I now think why I should sell the farm. With this farm itself, I can live a very happy life. So sometimes somebody should reveal what all available and what all the caution you should follow, so that these type of programs help us to caution us and to know what all things available and what all the preventive measures we have to follow. So I really appreciate Kirti Reddy Garu for Shilpa Reddy Garu, because Shilpa Reddy Garu for her very good initiative, and Bhaskar Reddy Garu for encouraging him. What's your name? Durga here. Dr. Durga for a fertility specialist. Anika. Director KIMS Hospital. Dr. Janagi, dermatologist. Aparna, neonatologist, for helping Shilpa Reddy. Shilpi Reddy or Shilpa Reddy? Shilpi Reddy. So anyhow, popular person only. Because too many names, before only I was attending another program where all Reddys were there. So, Reddys. So I'm really very happy to attend the program. Thank you so much. You are so... Bhaskar Rao. Bhaskar Rao, oh, you're Rao. So there's no problem. So sorry. So Bhaskar Rao Garu for this thing, because I didn't have any paper, then I just came here and but I have seen him in all the programs, because I am attending too many programs that Rao or Reddy, there's no any problem, I think. But anyhow, we are all good humans. Whether we are Rao or Reddy, we are all good humans. So that is very important. So I am really very happy to attend this program, and I see the multicolored women here. I always love to attend the women program, because men program will be very black and white or some. So this multicolored. I am really very happy to attend this program. Lovely ladies, thank you so much.